Good morning or good afternoon, wherever you are in whatever part of the world. Welcome to this second webinar series. My name is Prashant Kumar. I'm a professor and chair in Air Quality and Health and the founding director of the Center, the Global Center for Culinary Research. So I will be, I'll be providing you a little bit of background, to start with about this, this webinar, and then introducing to our, the speakers and our, the opening, the guest, Professor Paulie Smith. So just to tell you a little bit about the housekeeping notes. So this webinar is being recorded, so that it is available later on to whoever is interested to watch. If you have any questions, please use the Q&A button, which you can see on the bottom of your screen, and I will read out your questions to the speakers towards the end of the webinar. If you wish, you could put your name and country or place wherever you are from, so that I can give that reference as well, if you wish to be named during that question answer session. So yeah, I mean, just to give a very quick update, actually, what this, this webinar series is all about. So this is a knowledge transfer and practical applications of research on indoor air quality. So it's kind of a the networking project, which is funded by the University of Surrey's EPSRC kind of pot related to the ODA. So the idea here is to develop a knowledge exchange kind of platform across the ODA countries with the aim to share and discuss the state of art best practices on indoor air quality and respiratory infection. So it includes around 12 ODA countries as a direct partners into it, which has been covering around 13 cities, including 12 of the eyes and over 40 researchers, across the board. So these are the countries and the cities we have been focusing on. So this is includes the countries in Latin America, which is Colombia and Brazil. So we have the speakers today from these countries, and then we have Middle East, which is including the Egypt and the Kurdistan in Iraq, and we have then Southeast Asia, having Bangladesh, China, India, and also having 4 countries from Africa. So this network is kind of going from the last the over 3 years now. It started with an initiative through the ODA funding, which is called the Clean Air Engineering for Cities. The focus there was to look into the aerosol exposure inside the cars. So there were intensive work, carried out as part of these, this work, and you can see these papers which were published. And then it followed up with another project, which is called Clean Air Engineering from Homes, so which ended basically, the earlier this year. So that idea here was to look into the kitchens of the low-income homes across the same, the cities, and we added one of the cities of Nigeria, which was not part of the the earlier program. So here we have this series of 7 webinars. So today is the second one, which is led by Professor Maria Di Fatima Andrade and Professor Yris Olaya and his colleague. And you can see there are upcoming seminars. So the next one will be on 19th November 21. That is coming from our collaborators from India and Bangladesh. So with that, I would like to, introduce my senior colleague, Professor Paulie Smith, to open this webinar. So Professor Smith is currently Pro-Vice Chancellor and Executive Dean of the Faculty of Engineering and Physical Sciences. He has held a wide range of posts, including the head of the School of Engineering and as Associate Dean International. In research, in his early research interests on mechanical behavior of composite materials, broadened to encompass a wider range of materials, and in particular cast iron assets in water industry. He's an author of more than 250 journal and conference papers and presented at numerous international meetings. So it's my pleasure to invite you, Paul, and introduce, open this webinar and introduce our speakers today.
Thanks a lot, Prashant, for those kind words. Can I just start by welcoming everyone, wherever you may be in the world? A project with kind of 12 countries and 13 cities is truly impressive. And it's extraordinary, really, how over the last 18 months, while we've all had to deal with the challenge of COVID in our particular countries, it's amazing how international engagement and collaboration has actually really thrived in that time. We've all learned how to do things differently. And while we all kind of want to travel and have face-to-face meetings, it's fantastic what we can do through this medium. Although I guess there may be some of you somewhere in the world struggling to stay awake, but we'll avoid that one. So look, it's great to have a chance to say a few words. Air quality is a topic of the most enormous importance, and it's great to see that Prashant, along initially with collaborators at North Carolina State University in the US and with Fatima in Brazil, has been involved in this area, I guess, for probably more than 10 years now. And it's really started to develop through the formation of the Center for Clean Air, but then also this tremendous sort of international collaborative project and other similar ones. So I'm certainly looking forward to hearing about the work that's going on both in Brazil and in Colombia. And we're hearing first from Fatima. So Professor Fatima Andrade is a full professor at the University of Sao Paulo, based in the Atmospheric Sciences Department. She's published extensively in the area of clean air and has done an enormous amount of work also in terms of sort of the impact of the knowledge exchange side of it. So Fatima, over to you, and very much looking forward to hearing what you have to say.
Thank you.
Okay. Oh, I will share my screen. Yes. Is it possible to see my screen? Is it okay? Okay. Well, good morning, good afternoon. I'm very grateful for the invitation and to be part of this amazing program of seminars. I hope that I can bring some information and call the attention for an important question. That's the exposure of the children to the air pollutants, specifically when they are at school. So I'd like to thank Professor Prashant Kumar for the organization of this event, Professor Paul Smith for the kind introduction, and for all the participants to be here. I am a professor at the University of São Paulo, working with air pollution and atmospheric aerosols, and I coordinate a group which involves many students and colleagues. Many of them are attending this conference today. I prepared my presentation following this outline. First, I will introduce some motivation and some information about the impact of the air pollutants on the children, and then some specific characteristics for the schools and the children in the population in Brazil, in São Paulo, some previous studies there in Brazil or here, and the new projects that are being conducted, 2 new projects, and the take-home messages. Well, the impact of air pollution on the children, it's very critical, and it impacts their future, because it impacts when they are, before they are born, and after when they are under 3 years old. Because at that age, the brain development is very rapid, and the babies and the toddlers, they need right ingredients for the health development. That is the good nutrition, safe environment, and the stimulation from the caregivers like the parents. And what happens when they're exposed to the air pollution? One important information is that the newborns and the babies, they take 30 to 6 breaths per minute, while toddlers take 24 to 40. When we compare to adults, adults take 12 to 18 breaths per minute. Then what we have is that the children, they have the smaller airways, they have more air coming inside, and also they are more exposed because they are closer to the ground and they are closer to be exposed to the emissions by the traffic and by the resuspension of the dust. And it's recognized that this impact can stay not only when they are children, but then in the adulthood. The World Health Organization prepared a lot of material, drawing out the information that we have already about the impact on the children's health related to the air pollution. And the numbers are amazing, because what they concluded is that the household and the ambient air pollution cause more than 50% of acute lower respiratory infection in the children under 5 years old in the lower and middle income countries. And the kind of effects, the effects are on the lungs, on the brain, and before the children are born, and also cancer and heart diseases. If we look this map, prepared also by the World Health Organization, this map shows the children under 5 years that live in areas where the guidelines for PM2.5 are exceeded. This is the old guidelines of World Health Organization, because now this year we have new ones. And even compared to the old guidelines, they conclude that they have more than 600,000 children under 5 years that died from diseases caused by air pollution or exacerbated by air pollution measured by these fine particles. And globally, they conclude that 93% of all children live in environments with air pollution level above the guidelines from World Health Organization. This now will be updated and probably the numbers will be worse. And when we look to all these countries, which countries face the worst problem? We have here in the African countries, the death rate per 100,000 children is higher. Then we have the Eastern Mediterranean and the Southeast Asia, with high proportion of children impacted by the air pollution. But when we think about the schools and the impact in the schools, what we have? We have the effect of the outdoor sources of air pollution. We know that traffic, power plants, industrial plants, constructions, waste disposal, that is a very big problem that we face here in Brazil, and I think in other countries also, agricultural activities. And all these sources, they emitted a lot of deleterious pollutants like carbon monoxide, nitrogen dioxide, sulfur, particulates, and polycyclic aromatic hydrocarbons. All these are emitted outside, but they come inside and they cause impact to the children. But then we have also some indoor sources in the classrooms, as dust, construction, evaporation of volatile compounds, paints, cleaning products, mold. And here we can stress also the mold, the bacteria, pet detritus, insects, pollen that are biogenic compounds, biogenic emissions. And all this, it's also here a reference that related the traffic air pollution, the NO2, with increase in the allergenic rhinitis during the childhood, and even before the children are born, when they are in the uterus. Show an increase in the odds ratio for this kind of development of allergy after the children are born. Going to Brazil to have the data related to this preschool education, that's our focus today. I put here the map of the Brazil, the state of São Paulo. This is the metropolitan area. And this in the middle of the metropolitan area, we have the city of São Paulo, that's the municipality. We have in the municipality almost 700,000 preschool children. That's children with less than 6 years old. We can see with this number the high importance of taking care of the quality of, not only the quality for the quality of all the environment. We divided the students in the day nursery for children under 2, kindergartens for 2 to 3 years old, and preschool for children between 4 and 6 years old. I put here a review of some related studies in Brazil to the problem of air pollution. One that I think it was very important, it was in 91, it's NODE report, a NODE paper. It analyzed the effects of heavy industrial pollution on respiratory function of the children in Cubatão. Cubatão is a very industrialized area. And until now, it faced problems with air quality, but in the past was really bad. And at that time, they took 600 6-year-old children attending different kindergarten schools, and they do these respiratory airflow rates. And here I try to illustrate how it can measure this peak flow or airflow rates. And they analyzed the PM10 concentrations. And then they found that there was a significant correlation, association of decrease in the flow rates when considering the exposure in the last previous month. Another study that I put here, because I think it also illustrates the impact of reducing air pollution in this case, they analyzed data from 86 and then in 98, 2 different years, more than 10 years apart. And they published in 2003 that when they consider the children that lives close to places where the air quality improved, then they have the reduction in the prevalence of respiratory symptoms where pollutants levels decreased. Another work here is also the analysis of this peak respiratory flow and allergen in children. And they also see that the daily exposure to air pollution can be responsible for a chronic inflammatory process that might impact the lung growth and after the lung function in adulthood. These studies are in São Paulo. And here I put another place, like this first study here in Vitória, Espírito Santo, that's a capital city in Brazil. And this is much more, this is from this year, and it is have an integrated approach. They consider the air quality stations, the data measured in air quality stations, data come from low-cost sensors, and also modeling with Worth-CEMAC models to have the evaluation of the concentration in now the urban area, and then they relate the data, all this information, with the exposure to the children, finding a high correlation between exposure and impact in the children's health in Vitória. Another important city in Brazil is Rio de Janeiro, is the second largest city in terms of population. And also they had this work here in 2009, showing that if we have an increase in PM10 and NO2, we are going to have this decrease in the peak flow after the exposure to the air pollution. The last one is also a paper that was published recently showing the relation between this cancer in children and the relation between the cancer and so it was a positive association with traffic and NO2. The last example that I would like to show is this work that was performed in a school, urban school in the São Paulo city, that compared the air quality inside and outside the school, but not only the concentrations of the particle, but also the composition of the particle. And then what they have here, the indoor, for most of the metals, they have higher concentration indoor than outdoor. The same for the polycyclic aromatic hydrocarbons. Most of the concentrations indoor are higher than outdoor. Now we have here, for instance, sulfur and calcium chloride, and also many PAH. And even for the ions like sulfate, nitrate, and ammonia, the concentrations indoor are higher than outdoor, and much more higher. And the concentrations, they are low, they present low carcinogenic and mutagenic risk because the concentrations in total were not so high. But all these analyses helped to identify which sources are impacting more inside the classroom. And as expected, it was the traffic emissions. But how to translate all the information to the public, to make the community assimilate that it's really important to take care of the air quality, mainly related to the children. I'd like to present here this guidance that was prepared by Professor Prashant Kumar and collaborators about the mitigation exposure to traffic pollution in and around schools. And important messages were given here because it translates all the information to a language that can reach the public. For instance, this paper that was prepared by Shamar and Kumar showed the impact on the exposition and the resuscitation to the children and to the toddlers. And this information found in this journal paper that 6% of that the brain babies and young children breathe 6% more polluted air than adults. This was translated in this kind of information with the guidance for the community. Talking about the two projects that are being developed, one is in São Paulo nowadays, one is this Urban 95, that's the question that it was put in this project. If you could experience your city from an elevation of 95 centimeters, the average age of a 3-year-old, what would you change? Then the strategy in this project was collecting data with low-cost sensors and important, creating awareness of why clean air is important, and also taking corrective steps to improve the air quality. The participants here is the coordinates Professor Regina Miranda with participation of other collaborators, with funding from WR Brazil and Bernard Van Leer Foundation and collaboration with the University of São Paulo. The schools that are being sampled, it's 5 schools. They are in the periphery of the city. And I will show data only for an example of data from this school in East Zone. This graph showed some peaks of concentration. And the strategy was to use low-cost sensor, compare with data from our environmental agency, CETESB. And in this picture, it's possible to see that some peaks are higher than the concentration, the air quality standard in Brazil for 24 hours, and much more than comparing to the guidelines from World Health Organization. Here it's showing the place where it's in a community, and outside we have the sampling, and also inside, this is the sampling that is being used. It's a low-cost sensor. It measures PM 2.5, PM 10, temperature and humidity. And the contact here of the coordinate, Professor Regina Miranda, and the PhD student, Luana, that is responsible for the measurements and is doing her PhD with this subject. Another project is this Aires Nuevos. That is a cooperation project of the Citizen Network for Air Quality in Early Childhood with the participation of 18 Latin America countries. And the coordination is from the medical school at the University of São Paulo. And I put here 2 participants that are in charge of all the measurements, Veronica and Evangelina. And the funding comes from these Horizonte Cidadano, some institutions, and also with the collaboration of the municipality of São Paulo. And this project also has the aims to outline and implement local and community actions to reduce the children's exposure to contaminated air through the execution of low cost and high impact initiatives, which can be replicated regional and global levels. Also, the measurements will be taken in 5 schools at different parts of the cities. The selection of these schools, preschools, is the proximity of the most intense traffic routes, accessibility and representativity of the different regions of the city of São Paulo. Here we can see the CETESB air quality stations that our network for air quality that is run by the Environmental Agency of São Paulo. And this data can be combined with the low cost sensors. The schools, now it is a picture without the children because of the lockdown during the pandemic, but the idea is to measure in schools like this that are for preschools, children. And the contact for this experiment, we have Veronica Brandt and Evangelina Bormitag. Veronica collaborates a lot here with the University of Surrey with group from Prashant. The air quality monitors that are being used are these monitors here from Air Visual. They measure PM2.5, PM10, CO2, temperature and humidity. They are also being compared with the sensors from the Environmental Agency. Well, as a summary and message that I'd like to stress now is that air pollution inflicts short and long-term damage on children, and this makes some impairment to the development and can cause chronic health problems. The young children are most vulnerable because they breathe more air and travel or play close to source of pollution like the vehicle exhaust. And then we need to have a comprehensive set of policies to reduce the emissions to protect the children. And all these actions need to be at all levels. And one thing that I took here from these guidelines for mitigation the exposure to traffic pollution in and around schools, these guidelines that we have here, and also this guidance was translated to Portuguese and to many other languages, is to keep a clean air zone around the schools to prevent the children from being exposed to pollution. Also keep good conditions, good air quality inside the schools, and establish some projects that can join the citizen to incorporate the community to the problem. And the last point that I would like to stress is that I consider one of the most important is to have the question of air pollution issues in the education. That is to have to bring to the curricula of the schools the importance of the air pollution and the importance of keeping a clean air for the children. With this, I would like to thank your attention and give you my contact. Thank you.
Thank you, Fatima, for an absolutely fascinating presentation. I encourage colleagues, audience members to put questions in the chat if they wish. There'll be opportunities actually in the sort of the formal Q&A after we've had the second set of presentations. So we're going to stay in the same country, but sorry, the same continent, but switch countries. We're going from Brazil to Colombia. So be delighted to welcome our two speakers from Colombia. Shortly, we'll hear from Daniel Bolanos, who is an environmental activist and citizen scientist. We'll be testing the video link again there, so fingers crossed for that. But first, we're going to hear from Professor Yris Olaya. Yris is an associate professor at the Department of Computing and Decision Sciences at the National University of Colombia, and her research focuses on developing models for supporting decision-making and addressing sustainability issues in energy and minerals production. So Yris, over to you.
Thanks for the presentation and thanks for the invitation to this seminar. I'm going to share my screen, and please let me know if you can see the video, the presentation. Today, I will be presenting you some results and some advances in monitoring indoor air quality in Colombia. And I will be presenting you a video that Daniel Bernal prepared. He is a citizen scientist and he belongs to several citizen science collectives. And I will also present some results that we developed here in the Universidad Nacional de Colombia when we were invited by Professor Kumar to join the Care Home project led by the Global Center for Clean Air Research. So first of all, I'll give you a brief background on indoor air quality in Colombia, and then I will show you some of the work we did for the Care Homes project here in Medellin. And later, Daniel will share with us the experience he had with citizen initiatives for air quality, especially in Bogotá, Colombia. And I'll start with this fact that is here in Colombia, we have no quality standards for indoor air. We do have some general guidelines for ventilation in workplaces, and we do have technical standards for ventilation in rooms with natural gas appliances. More recently, last year, there were some recommendations developed for occupation and ventilation. These were made in order to mitigate COVID-19 transmission and are based on areas and distances. And what we noticed talking to the colleagues, and I work in a university, so we were preparing for opening our courses to the students. What we noticed was that we didn't have good data about air quality and ventilation in closed spaces. And this includes homes. And this is an issue, as you could see in Professor Fatima presentation. We spend most of our time indoors. About 90% of our time is spent at home or in our workplace. And the air quality in these places can be sometimes worse than outside. And it's not that air pollution is not an issue in Colombia. It is an issue, and it has been studied, especially it has been the policies and the studies have focused on rural and extreme poverty communities. Why? Because these communities do not have access to clean and efficient fuels for cooking. And as they don't have good sources of energy, they have to rely on solid fuels for cooking. And sometimes they have poor ventilation, and this causes a lot of illnesses and is harmful for health. And there have also been some studies in the line of the ones that Professor Fatima presented. For instance, this one by some Franco and Professor Nestor Rojas in the Universidad Nacional in Bogotá. They measured exposure of school children in Bogotá, and they found that they were exposed to air pollution in outdoor environments and microenvironments of their schools, and also in the classroom. And what we find from the studies that have been done in Colombia is that we need to focus also on urban air quality. There have been more studies dealing with air quality in transportation, media, and also in outside. But the progress in indoor air quality measurements is less. And the motivation for this presentation and the topics we are presenting to you today is this, that we really don't know very well what the quality of air is indoors in Colombia, and there's a need for understanding better how are we exposed to different pollutants and how we can improve air conditions. So in this project, Care Homes, that was led, I said already, by Professor Kumar, and we developed measurements along with other colleagues and groups from global cities, 12 cities around the world. And what we are showing today is some preliminary results for the metropolitan area of Medellin. And I'm going to show first the city of Medellin here in the globe. Here we are. And this is the province where Medellin is located in the northwest part of the country. Here is Medellin. All cities participating in this study selected homes from low and low income neighborhoods. And in these homes, a couple of monitors were placed in the kitchens where there's combustion of fuels. These monitors were an AeroQual 500 series for PM 2.5 and 10, and a Hovo data logger for CO2, humidity, and temperature. Ideally, measurements were taken for 5 days, consecutive days. Sometimes we couldn't do that, but we had 5-day measurements for all homes. So here's an example of the setup of the monitors. They were placed in front of the stove. And in this side, we can see the monitor in another house. All these houses have different structures. And what they share is they are all using natural gas as a fuel for cooking. They all have natural ventilation, and the occupation of these homes is different, but we have a representative sample of living conditions around the metropolitan area. Here in this map, we can see the location of the homes. They are in 4 of the 10 municipalities of the metropolitan area of Medellin, which is all this big area. Medellin is here. And we have some results here that we obtained during these measurements. As you can see, we started in July and these run until September almost. And below we have the indoor PM raw readings for the homes. And in this part here, we have these are measurements, hourly average for the reference stations, the stations that belong to the regional monitoring network for air quality. So these are average that are measured with certified equipment. And as we can see, these minute measures, they have peaks, very high peaks of particulate matter 2.5. This is due to the type of cooking and some other events that can happen during the day. And in this other graph, we can see some CO2 concentration levels indoor for the same homes. And as we, when we compare these ppm concentrations and we compare them with the scales that have been developed to assess how good ventilation is, we can see that there are in some houses, in some homes, the number of values above 1,000 is high. These houses would need to improve ventilation during times of the day to see what strategies they can implement to improve ventilation. And this is also a result of the way these houses are built and where the kitchen is located, whether they have access to outdoor air or not. But in general, when we take the average of these PM 2.5 concentrations, what we find is that we have values that are similar to other values that we found were measured during the same project. However, these values here need to be revised, and this indicates that some strategies can be developed to reduce exposure to this sort of pollutants. And the same can be said about the CO2 levels. They are in general in a fair and good level, but could be improved, especially during cooking. And this needs to be further studied in order to come to some conclusions and recommendations. So these are some of the work we have been doing here in Medellin, but there have been more initiatives in Colombia, especially the ones developed by the citizen scientist collectives. And that's why I would like to introduce you Daniel Bernal. He's an electronical engineer. He's a citizen scientist and an environmental activist. He has worked on ventilation, air quality, wetlands, and he is a member of the National Network for Air Quality and one of the leaders of the Canario and Citizen Air Collective. So I will present the video he shared with us.
Hello to everyone. My name is Daniel Bernal from an initiative, citizen science initiative called Canario and Aire Ciudadano. Thanks for the invitation, teacher Yris and University of Surrey. I'm going to share my screen. And the presentation is called Citizen Monitoring Indoor Air Quality. And the origin of these two initiatives is for a big problem that we have in my city, Bogota, in Colombia. This is the most successful BRT, bus rapid transportation system in the world. Transport 1.4 million passengers every day, but have a big problem of bad maintenance and old buses that produce that smoke clouds. I start with buying some low-cost sensors from China and import to my city and start to measure many places like wetlands, avenues, parks in my apartment. And the most important measurement was made in August that I measured in Transmilenio, and the values are very high compared with the other measurements. For example, when you go in a bus, you measure 100 to 140 micrograms per meter, cubic meter, particle material that 2.5, and at the station is the half, and outside 10 times less. Then we have a big problem in Transmilenio that make this problem very public. The media, journalists, and in social network, this movement of measurements in this transporting system union some people of hardware and open software, and at September 2018, start Canario. That Canario is an open initiative, an open data that published all the instructions and materials in GitHub and Hackster, and have an app in Play Store, and use an Influx TV server for the fixed stations. You saw at the right a mobile device that can be used in our home or in our bicycle for measurements indoors and outdoors, and you can produce maps like this one that have colors that represents the air quality. And at the right, you can put your sensor in a fixed mode using Wi-Fi. You put in a place wherever you want, for example, for indoors in your home or for outdoors in a place that receives the outside air, and produce maps, alternative maps of our city. For example, this map of my city, Bogota, with low-cost sensors. And at this time, we calculate that 300 sensors, Canario sensors, are built. At this time, 40 fixed stations are reporting, and 20 mobile reporting. With the COVID, these numbers are going down. And we put tutorials, videos for people that like to build a Canary. And the other part is the CO2 measurements, because CO2 is an indicator of the risk of infection. You measurement CO2 and have an estimation of ventilation and a risk of estimation of infection. I designed a project called Libre CO2, open source, with very popular and cheap materials. And with Canario, I made many measurements. For example, in my city, a vaccine location that have very bad values of CO2, an average of 1,000 ppm. And it's a big problem because this is a public and in this time a very used place, but unfortunately nothing happens. I report these values, but nothing happens. And other problems that we measure is the public transport, for example, because the ventilation in the buses or the public buses are very poor, and we have a lot of CO2 measurements, very dangerous. And with this data, this is a pedagogical activity, because unfortunately the government don't make anything. Thank you very much. I put these links and formats if you like to contact me, please write me or contact me via Twitter or my mail, and these are the webpage of these two initiatives. Thank you very much for the invitation.
Thank you very much, Paul, for introducing the speakers, and Professor Olaya, Daniel, and Dr. Andrade. I think we can possibly, there are a few questions coming up. So if you haven't really asked any questions, you can just put them in your chat box, which is a Q&A. There is a little icon on the bottom, so I can pick them up and, pass it on to our speakers today. So I think it's a question. Let me start with one question for Professor Andrade. On the school front, actually, what kind of measures are being taken, especially for mitigating the COVID impact in schools in Brazil or in Sao Paulo in particular?
During the lockdown, we had no children at the school, and now they are starting coming to the schools again, but they are asking to use the masks, and also to clean more the hands, to wash the hands, things like that. But the configuration of the classes, they are not changing.
Okay. So
only, yeah, well, keeping more space between the chairs, but now they are asking all the students to return, and then it's not possible to have enough space between the chairs.
Okay, so because you might have seen that there is quite a lot of emphasis given on the ventilation, when it comes to the COVID-19 spread, especially for the airborne transmission. So, so basically, there is nothing in particular being done in that direction.
Yeah. Yeah. Usually, in the public schools, they don't have air conditioning, and then they keep the windows open. Okay. It's common that because of the hot weather. But in the private schools, usually they have air conditioning. And what is doing now, as what I know, is that they ask for not use the air condition and keep the windows open. This is instructions that are being
So
applied.
there's a question coming from, thank you, Fatima. There's a question coming from Dr. Francis Olawale Obuludu from Nigeria. And he has asked, are there local sensors for monitoring aromatic hydrocarbons, which is pH?
No. I've seen local sensors for measuring total hydrocarbons, but not to discriminate between among the hydrocarbons. No. And this one that I showed, they are measured in the filters, the composition. Then I don't know how this could be in low cost sensors now.
Yeah, just to ponder a little bit that there is an opportunity of having the VOC sensors that can give you the VOC information. But as you rightly pointed out, I believe that there are not many specific sensors which could do the pH, direct pH measurements.
Yeah. The problem is the speciation. You can have also the total, but the speciation, it's difficult.
Yeah. So there's another question from Dr. Diana Ogudalo Castaneda. Sorry, my mispronunciation. I would simply call her Diana. So I think Diana has asked, was included any information on ventilation in these studies? So I believe it's referring to the question related to the care homes. So, the monitoring you have been doing in the as part of the care homes. Do you want to say something, Yris, and possibly Fatima later on?
Well, yes. The thing is, we haven't finished analyzing the data, but when the data were recorded, we registered the conditions for cooking. Was the window open? Was the door open? And are there any fans in the kitchen? Were they on during cooking? Are they on during the day? Do you have air conditioning or another ventilation equipment at home? Is it on during the day? So we did have to follow these conditions. In general, these homes, they don't have ventilation equipment. They just use natural ventilation. And they are mostly constrained by the construction of the kitchen and the house.
Yeah. So,
and I think the data, the CO2 data, can give also an indication of the ventilation. No, and indirectly it can complement the information about the ventilation inside.
Sure.
Yeah. So I think. Maybe we have 5 more minutes, so we can continue possibly with the other questions there. What kind of challenges do you see in terms of improving the air quality, especially inside the homes? Because I guess the barrier is that the homes are built actually, in a way they are, and it's very difficult to restructure them. But at the same time, I guess there are opportunities to change certain behaviors or certain kind of, the practices so that the people can benefit from it. So I'm just wondering whether we have any opinion on that, or any, what could be the measures that can allow people to improve their exposure inside kitchens?
Oh. Well, I will start. I think here we are facing a problem now, that is the use of solid fuels, like because of the price of the gas for cooking. People start using burning wood, burning waste, and this is really a problem. And also sometimes they have this practice of burning the waste. I think this is important to tell the people that's terrible, for the conditions, because usually when they burn the waste, it's close to the house, and then you have all this smoke inside the house. I think this is a very big problem, because also we have a lot of houses that are close to the streets, to the big avenues, but it is very difficult to avoid or ask people to move to another place. Then they face this problem of living close to big avenues, and then they may be aware that they will have bad air conditions because of their quality, because of the exposure to the traffic. I think this could be improved if we have and we have here, but it's very difficult to implement, that starting moving from diesel to clean fuels for buses, and this would help improve the air quality in the houses that are close to the main roads.
Yeah. Do you want to add anything?
Well, and you have to look at the particular conditions of the homes and the neighborhoods. We saw in one of the homes we measured that they had a very narrow alley where the door is located, and the neighbors, they park motorcycles. So practices like turning the motorcycle engine off could help. Don't turn the motorcycle on if you are in the morning preparing to go into work. That kind of practice could help improve the environment, because as Professor Fatima said, they cannot move easily. And I think when data are further analyzed, we could maybe develop some recommendations of what good could it be to have a fan in the kitchen, because in the homes we saw, they don't use that. And if they have a fan in the kitchen, the ones that they're built under the cabinet, they never turn it on. So we could try and see if these strategies actually improve air quality indoors.
Yeah, that's very helpful. Yeah, so thank you very much. I don't see any particular questions in there anymore, and we are reaching towards the end of 1 hour as well. So I can see there are 2 more questions that came. One from Waqas Ahmed from Pakistan. He's asking about whether this network will be, the open, and they are interested to join. So I think you're most welcome to write to me, and we will look for the opportunities. We are always keen actually to have anyone who wants to join, and it's a collaborative effort. So there are a lot of opportunities, and we keep looking for certain opportunities as well. So yeah, so the answer is yes. There's another question asking about this webinar is available on YouTube. We have so we have the YouTube channel, and you can see all these, the webinars there. So this will be uploaded at some point. And if you have registered, then you will also get an email with the link. I put the YouTube channel link in the chat box, so you can click on that, and you can even see the previous webinars, and all the other webinars in the series will be uploaded there. So thank you very much for that. And before I finish, I would like to announce basically the next webinar. So that has been, been done by 2 of our, the very close collaborators from Bangladesh and in India. So So Professor Siva Nagendra from IIT Madras and Professor Abdul Salam from University of Dhaka. And they will be sharing their perspective on the indoor air quality and the respiratory infection side of things from the South Asian perspective. So this webinar is on 19th November, 2 to 3 p.m. And you are most welcome to register. So you can see the chat box. There is a link there. So please, you may copy or you can forward it to whoever is interested, to join this webinar. So before I close, I would like to thank again our, the speakers, Professor Maria Di Fatima Andrade and Professor Yris Olaya for fantastic presentations, and to Daniel that he was not able to be available with us today, but he managed to find time to do the video, which was very, very informative and very useful. So thank you very much, everyone. And not last but not the least, actually, Professor Paulie Smith for his time to introduce our speakers and giving the opening kind of remarks for it. And there are a number of colleagues, actually, we have been working in the background. So for example, our event team, Anna and colleagues doing fantastic job. A number of GCARE members actually who has been spending a lot of time preparing the posters, disseminating the information, and all the care homes team actually, I know who has been supporting all this initiative. So if I start taking names, I think it's going to take a long time. So I would like to thank everyone and acknowledging all their efforts in the background. It's me who is showing the face and taking possibly most of the credit, but these are the people who are really working hard behind the scenes. So thank you very much, everyone. And we'll see you in the next webinar.
Thank you.
Okay, bye.
Thank you.